Is the existence of mental disorders an undeniable truth or a social construct? A question that has been the epicenter of countless debates, stirring the minds of psychologists, philosophers, and curious thinkers alike. On one hand, the medical model asserts the reality of mental disorders. This perspective, rooted in biological and neurological evidence, posits that mental disorders are as real as physical illnesses. Disorders such as depression, anxiety, or schizophrenia are seen as tangible dysfunctions in the brain's structure or chemistry. Proponents of this viewpoint often point to neuroimaging studies and genetic research that demonstrate identifiable differences in the brains of those diagnosed with mental disorders. The medical model, therefore, sees mental disorders as an objective reality, independent of societal or individual interpretation. On the other hand, the sociocultural perspective argues that mental disorders are socially constructed. This viewpoint suggests that what society labels as a mental disorder is a reflection of cultural norms and values, rather than an objective reality. Proponents of this perspective argue that the definitions and classifications of mental disorders are subjective, varying across cultures and historical periods. For instance, what might be classified as a symptom of a mental disorder in one society could be seen as a normal behavior in another. So, is it possible that mental disorders are merely constructs of societal expectations? However, it's essential to consider that these two viewpoints are not mutually exclusive. The biopsychosocial model, for instance, combines elements from both perspectives. It posits that mental disorders are real, but their expression and interpretation are shaped by societal and cultural factors. This model suggests that while there may be biological predispositions towards certain mental disorders, social pressures and cultural norms play a significant role in their manifestation and recognition. In the grand scheme of this discussion, it's crucial to remember that the viewpoints presented are not definitive answers, but rather different lenses through which one can understand the complex nature of mental disorders. The medical model, with its empirical evidence, offers a tangible view on mental disorders. Meanwhile, the sociocultural perspective provides valuable insight into how society and culture shape our perceptions of mental health. And the biopsychosocial model reminds us that mental disorders are multifaceted phenomena, influenced by a combination of biological, psychological, and social factors. In conclusion, the reality of mental disorders is a complex and multifaceted issue, shaped by various perspectives. From the objective viewpoint of the medical model to the subjective interpretations of the sociocultural perspective and the integrative approach of the biopsychosocial model, each offers a unique insight into understanding mental disorders. While the debate continues, it's evident that each viewpoint contributes to the broader understanding of mental health, and all are necessary for a comprehensive approach to mental health care. The question is not about which perspective is right or wrong, but rather how can these different viewpoints work together to improve the understanding and treatment of mental disorders. After all, isn't the ultimate goal to alleviate suffering and enhance the quality of life for those dealing with mental health issues?